Welcome and good afternoon, everyone. We'll now begin our webinar. This session is being recorded and will be available later for viewing. My name is Sarah Slocum, and I am Deputy Director of the Altarum Center for Elder Care Improvement. I'm very pleased to be with you today and honored to introduce this stellar panel. We will hear from Tyree Brown, who is an artist, a disability advocate, and a Medicare and Medicaid beneficiary. Allison Barkoff is Principal Deputy Administrator of the Administration for Community Living within HHS, and Jean Axius heads up Global Thought Leadership and International Affairs for AARP. All of these panelists bring their deep knowledge and experience in different roles, always working for the highest quality and choice of services and supports in the least restrictive setting possible for people with disabilities and frail elders. This is the second webinar in a 3-event series. The first webinar in late March focused on equity issues for long-term supports and services workforce, in particular the direct care workers, who provide the majority of the hands-on supports for people who need care, and the issues, barriers, and challenges they face, and coming solutions through policy and legislative change. This webinar today is focused on people who use services and how equity issues impact them as they seek to live their fullest lives. The final webinar in the series is coming up June 9th, and will bring together experts who will address solutions and lay a path for our way to better, more comprehensive services that are available in a more equitable way. A little bit about my background is that before coming to Altarum 4 years ago, I worked in various jobs in Michigan, all related to elder care and long-term supports and services advocacy from a consumer perspective. Most recently, I served 13 years as Michigan's state long-term care ombudsman, where I had the opportunity to work to uphold resident rights in residential settings, but also to participate in Michigan's Olmsted Coalition, promoting expanded in-home options, and the setup and ongoing oversight of Michigan's Money Follows the Person program, aimed at helping people who live in nursing homes with support and options to move back to their homes with services. I'm also currently chair of the National Consumer Voice for Quality Long-Term Care Leadership Council and chair of the Michigan Disability Rights Coalition Board of Directors. Altarum's Center for Elder Care Improvement is working toward more equitable, high-quality services on a number of fronts. We have a project in Michigan to bring culture change learning to nursing homes with our training partner, the Eden Alternative. We're taking a quality improvement lens to looking at what happens, what really changes when a nursing home works toward providing more person-centered care. We also have various projects aimed at expanding PACE, the program of all-inclusive care for the elderly, and to improving the lot of the long-term supports and services workforce through policy changes and recommendations that will improve the quality of those jobs and hopefully draw many more caregivers into those professional roles. All of this is done with an eye toward improving equity and choice, access, and quality of long-term supports and services. Disadvantage can cause inequities in health outcomes, both among those with disabilities and during older age. Some issues to explore and discuss include shortages of accessible, affordable housing, a need for expanded grant funding for home renovation and repair, housing with services and universal design, new construction that's meant for everyone, a need for reliable, subsidized, accessible transportation for those who don't drive, socioeconomic barriers that contribute to a higher prevalence of chronic conditions among Black Americans and other persons of color, notably asthma, cardiovascular disease, stroke, and diabetes. Social isolation and loneliness challenges for lower income elders living alone, and the racial retirement gap. These gaps, along with disparities in quality and supply of services, make the care inequities a civil rights issue. All persons should have access to high quality, affordable care in the setting of their choice. Our panelists will help us think about such questions as what is the relationship between Medicaid, Medicare, and Older Americans Act funding for elders and individuals with disabilities today who are disadvantaged? What is covered and what is not, and what changes are policymakers considering that aim to squarely address social determinants of health. A general business case would call for buttressing these programs and others with key investments in housing, transportation, improved employment opportunities in a virtual world for individuals with disabilities, and a larger workforce that is trained and equipped to deliver supportive services at home. With financing to support these, in order to offset social determinants disadvantages that otherwise accrue over a lifetime and cause disabilities at older ages. Spending down to Medicaid in order to access long-term care, as Medicaid is currently the safety net and coverage for long-term supports and services, is another critical issue. Medicaid requires people to have low assets and low income, and Medicaid is always a big piece of the puzzle in long-term supports and services discussions. So during this session, you've heard from me a little bit, and I'll have a few housekeeping items to talk about in a second here. You're going to hear from each of our panelists for about 10 minutes in prepared comments, and then we've left ample time for questions and answers. We really want this to be a conversational and participatory event, and we hope that you'll feel free to put your comments and questions in the Q&A function at the bottom of your screen. Please do not use the chat function. We might miss your question if it goes there. So please use the Q&A, and we'll get to as many of those questions as we can towards the end of the session. A few housekeeping items. Attendees will not be able to turn on their camera or their microphone during the event. So really the way to communicate with us is through that good old Q&A box. And we encourage you to use that to enhance our conversation. This session, again, is being recorded and will be available shortly on Altarum's YouTube channel. So now on to our first amazing panelist. I'd like to introduce Tyree Banks. As I mentioned, Tyree is an artist. I got your name wrong, Tyree Brown. Geez, I knew I'd missed something. My apologies, Tyree Brown. As I mentioned, Tyree is an artist who lives in Maryland. Through her experiences, she's become an expert on the Money Follows the Person program, as well as home and community-based waiver services. She's enrolled in both the Medicare and Medicaid programs and has developed a deep knowledge base about what it's like to navigate both of those large systems. We got connected with Tyree through the National Disability Advocacy Organization, the ARC, and we're very grateful to them for putting us together. Now Tyree will share with us about her experiences and insights as a person who uses long-term supports and services. Tyree, take it away.
Hello. Okay, so if I can, I thank you, Sarah, for the introduction and information that you've given. I want to thank Anne for looping me into all of this so I can be able to speak to you all. I'm grateful to be here. If you hear dogs barking in the background, please excuse me. We have 3 new puppies and 2 large Rottweilers. But if I give some information about myself, as Sarah said, yes, I am a beneficiary of Medicaid and Medicare. But before that, I wasn't, because I was an able-bodied person just going to college, doing her own thing, not worried about injury, disability, or anything. And then in 2015, I was in a car accident and I became quadriplegic. And that is an injury of the spinal cord in the cervical area, which is in the neck area. I was paralyzed from the neck, well, the shoulders down, and I had to go to the hospital. And being in the hospital, I don't really know what's going on. And everyone had to fill out paperwork for me. And somehow I was looped into Medicaid somehow. And I know this because they're like, okay, here's what you're going to do. Here's how you're going to be taken care for in this hospital. And here is your next step. And when they told me my next step is to be in the nursing home, I was like, okay. But before then, I was in rehab, and my rehab specialists, the case managers there, they're navigating me through my new normal, which is being, I guess, disabled. And this was new to me because I had no idea what disabled meant, at least being quadriplegic. I had a stepbrother who's paraplegic, and he was my older brother. This is just how I knew him. I never knew him any other way. So he was my only exposure to anyone in the disability community, but I guess I never saw him as disabled because he had cars, multiple cars. He was living life in his own place, his own apartment. So I never knew being disabled meant having to go to rehab and having to be placed in a nursing home. So when I got to the nursing home after rehab, it was just kind of new because like I said, I don't know what's going on. I was surrounded by nurses, surrounded by doctors, surrounded by aides 24/7. And it was quite scary because I was away from my family. I was away from people that I knew. I couldn't leave. I was bound to my bed for weeks on end. And it was very difficult in order to navigate my life as a 20-year-old in the nursing home. Most of the people in the nursing home are in the range of 60. I think at the time, the youngest person there other than me was, I believe, 40. So I was alone, I felt. And I remember when I was in rehab, they said in order for you to get back into your home, you would have to be in a nursing home. And they said there's a program called Community Options, and I didn't know what they were talking about. This is the only thing that I remembered at the time. But when I'm in the nursing home, the only thing I can think of is I'm here forever, I'm doomed, this is it. And I stayed there for about 3 months, had to go back to another rehab. And then I thought, well, this is it, I'm getting to go home now. But rehab said, no, you can't go home yet because your home is not accessible. We cannot, in good knowledge, send you home. I had to go back to the nursing home for another 5 months until someone came into my room. His name was Mike Sanders, and he said, hey, do you want to go home? And I'm like, yes. And I always say this because I like this part. He's like, all right, here's what you need to do in order to get home. And I'm like, sign me up, get me out of here. And this was Mike Sanders he's a peer mentor or an advocate of the Money Follows the Person program. And he explained what the program was, explained to me what I needed to do, all things that I heard of before, but didn't know how to access. I didn't know how to apply. I didn't know what I needed. That's what he was there for. He came to my room, brought papers for me to fill out, and there I was able to be in the program. Weeks, he would come, this is what you need to sign. He took the paperwork back to the needed people. He came back, he said, hey, you are approved. I'm like, okay, now what? He said, okay, this is the end of my journey for you, and you will be handed over, how I like to say, to the state. From there, someone from the health department will help you navigate what is needed to be done. And I was given a supports planner. She came into my room and what was comprised of a plan of service, which is a breakdown of what is going to be given to you or awarded to you being in the community options program. The waiver program is how I call it and how I know. And this program helps you to get from the nursing home into your home, whether if you need a shower chair, commode, maybe you need a ramp, or maybe you need a stair lift. This is a program that'll help you do that. So months went by and they said, okay, this is your plan of service. Here's how you're going to get home. The first question is, do you have a place to stay? I was fortunate enough to have a place to stay because I was still living with my parents. But in the back of my mind, I thought, what if I did not have a place to stay? And this is true for individuals. There was this person in the nursing home who was ready to leave, but had no place to stay. And she was on a waiting list for years until she was able to get home. I am also on a waiting list for my own home, but I've been on it for almost 3 years now. So I'm still living in my parents' home. But in order for, let me back up. When I was in the nursing home, she asked me, do I have a place to stay? I said, yes. She said, what are the barriers? Why aren't you home? I said, first of all, I live in a house with stairs and it's a split level home. So this means that in order to access living quarters, living room, and the dining room, you have to go upstairs. And I don't have any way to get upstairs. I'm a wheelchair user and I cannot walk. So I would need a ramp to even get in the home, first of all, and then I would need a stair glide to get up the stairs. Here is the catch. The program does not offer these services unless you are in your home for at least 6 months. So I'm like, wait a minute. I can't go home because I can't get in my home. But in order for me to get in my home, I have to be home. It was confusing, but I said, oh, well, whatever it takes to get me out of this nursing home, I'll do it. So we had to definitely maneuver life. If I didn't have strong brothers and strong fathers and strong neighbors in order to lift me in up and down the stairs, then I would be confined to my home for 6 months. But fortunately, I had these people. But I always think in the back of my mind, what if I was maybe heavier, or what if I didn't have brothers or a father to bring me up and down the stairs in my home? I would be stuck in my home for 6 months because I was discharged from the nursing home in September of 2016, but didn't receive home modification services until the spring of 2017. So I had to very much rely on the mercy of my brothers in order for me to get in and out of my home. Another thing is I'm actually very grateful that the program even allowed me to be home. They gave me a home health aide coming out of the nursing home. They gave me the necessary things that I need while I was in the home, but there was just some, yeah, how would I say, runarounds in order to do that. My mom is now my home health aide. At first, I had an aide to come in from an agency to take care of me. Me and my mom, we work things out, and it's a better situation because at first she would have to rush home in order to help me, because coming home from the nursing home, when I was in the nursing home, I had 24-hour care, and that is what I needed. But the program, when I came out of the nursing home, only gave me 8 hours a day, 5 days a week. And I'm thinking, oh, well, the weekends must be great. I must be able to walk and do whatever I can on the weekends because I don't have any services or aid services to help me. But that wasn't the case. I'm disabled every day of the week, and I need help every day of the week. So it was also a fight in order to get more hours to have someone to take care of me, but we were able to get it done. My mom's taking care of me. I'm living better now. I have the wheelchair ramp. I have a stair glide. They open the doors so my wheelchair can fit into my room. I living life. I'm going to church. Even when I was in the nursing home, I couldn't go to church because church is at night. You have to be in the building by a certain time. And even on Sundays, I had to be back at a certain time. Sometimes they didn't want to get me dressed and I was late for service. Now I can go to service whenever I want, whatever day that I choose. I can go to my showcases. I've completed my associate's degree now that I've been home, because I did 2 years in college, but there was one class that I needed to take. So I was able to do that. I was able to get lots of things done being home. And in the nursing home, I wouldn't even thinking about that. I'll just doom and gloom every day. But I was in good spirits because I believe in Jesus and I believe that he will help me. But there's also this dark side of being in a nursing home that lots of people don't know because they may not see, and they may not know that 20-year-olds are in the nursing home. And this is true for a lot of people with disabilities. I want to show you all, I recently entered into a competition and I won first place. And this is the artwork. Let me see if I can get it for you all. See if you all can see. This is the artwork that I entered. Won first place, and it's due to the community of Independence Now, Money Follows a Person program. Got me into a program organization called Independence Now. They helped me navigate my life as a person with a disability, and I am extremely grateful for all of the programs out there available. Obviously, there's some little hiccups in the programs, especially with being home and not having the necessary things that I needed. But I'm grateful that the Money Follows a Person program got me out of the nursing home. My quality of life is just so much better. I'm freer. I'm also working on another project. I'm in my home, so I have my own little makeshift studio, and I hope that I can get my own place. This is something I'm working on. I'm an artist, so I have a website. It's tyreebrown.com. My Instagram is tyreebrown.art. You can find me wherever. You don't have to if you don't want to, but I'm just here to tell my story, and I hope I didn't talk too long. So thank you all for having me.
Thank you. Tyree Brown, what a great story. I mean, what beautiful art. I hope you're having a chance to glance at the chat box where people are making comments and really complimenting your work, Tyree Brown. So thank you so much for sharing that, as well as sharing your personal story that really grounds us in this work that we all are working so hard to try to improve. You know, we've come a long way from the old days when there was nothing but the nursing home, and programs like Money Follows the Person and the Medicaid home and community-based waivers have come into being. But and we're so, you know, it benefits all of us, Tyree, that you're able to live your life and create your art. And we're so happy that you've gotten to that place. But also your story tells us that there are still things that we need to fix and things that we need to do better so that people really can live integrated lives like you do. And there shouldn't be quite so many roadblocks in the way and so many requirements that cause frankly nonsensical rules like you have to be home, but you can't be home because you don't have a ramp. And we can't provide you a ramp until you meet this other rule. So again, just amazing. Thank you so much for sharing with us. And we're going to move now on with the rest of our panel. So our next speaker, we're also very thrilled to have Allison Barkoff. Allison is now working in the Biden administration as Principal Deputy Administrator of the Administration for Community Living. Allison is an attorney and has a strong advocacy background. She's been Director of Advocacy at the Center for Public Representation, a national legal advocacy center for people with disabilities. And she now brings that heart of an advocate to the federal agency that funds and oversees much of the community-based services that exist all over the US to provide elders and people with disabilities with options and supports that help them continue to live their own lives in their own homes in the community. Allison, over to you now.
Great, thank you. And thanks so much for having me. And really thank you, Tyree, for sharing your story. It's your stories that really motivate all of us to make big changes. And I'm going to talk a little bit today about some of the administration's priorities to further all of the goals that Tyree talked about. The mission of the Administration for Community Living is to ensure that all people, regardless of age, disability, race, ethnicity, language spoken, income level, sexual orientation, gender identity, where you live, or any other factor, has the right to live and meaningfully participate in the community. And as Tyree said, community living is what people prefer, it leads to better outcomes, and it's cost effective. But it isn't just the right thing to do. As Sarah mentioned, I've spent much of my career really thinking about community living through a civil rights lens. And people with disabilities and older adults have a civil right to live in the community under the Americans with Disabilities Act and the Supreme Court's decision in Olmstead versus LC. But to vindicate this right, to make this more than just a promise, people need access to home and community-based services. And that's really where the work of ACL and our federal partners is key. COVID-19 has laid bare the inequities that exist in our American healthcare system. It's true for so many people with disabilities and older adults, and especially true for people of color and others who experience additional barriers and discrimination. Over a third of deaths from COVID occurred in nursing homes and congregate settings, with higher rates occurring in nursing homes that had higher proportions of residents of color. People with disabilities and older adults face loss of services, placing them at risk of having to enter dangerous congregate settings. And as many people lost services, or services went virtual, their lack of access to technology and internet further exacerbated the digital divide. People with disabilities and older adults face discrimination in accessing life-saving treatment due to discrimination in crisis standards of care, where states or hospitals often rationed care by excluding or deprioritizing people with certain underlying health conditions based on their life expectancy or based on how long it would take them to recover. And this had a particular impact on people with disabilities and older adults who are Black, Indigenous, or people of color. And that's why disability and aging and racial justice advocates came together to challenge these types of policies across the country with great success. We saw the impact that COVID-19 had on the home and community-based system, from the direct care workforce, who are essential workers, but weren't treated as such when we were looking at access to PPE, overtime, hazard pay, and that just exacerbated the inequities in a workforce that is primarily women and women of color. And to family members who had by default to become the safety net and become caretakers, and in many cases leave their own jobs, again, having a disproportionate impact on women and people of color. One of the tragedies of the pandemic has really given us this opportunity to think about and really center in our response addressing the inequities that older adults and people with disabilities face. And that's why from day one, the Biden-Harris administration has centered equity and directed all federal agencies to ensure equity is a part of all of our work. The administration's view of equity, while it centers racial justice, it's through an intersectional lens, looking at what are the different experiences an older adult or a person with a disability might have, if they are a person of color, if they are LGBTQ, if they are low income, if they're in a rural area. And in ACL, that means looking at our own programs, at our own networks, with intentionality to identify and begin addressing these barriers. We, of course, are working off existing work. There's so much that's happening in the aging and disability community, and I'm really looking forward to hearing more from Jean about that. But even our own statutes, including the Older Americans Act, requires us to target our outreach, our funding, and our services to those in the greatest social and economic need, with a particular attention to income, people who are minorities, limited English speaking, and people at risk of institutionalization. And across of all HHS and the federal government, we in ACL are really working to make sure that as we're looking at health disparities and more broadly at equity, we are including with intentionality an intersectional lens that includes older adults and people with disabilities. I want to talk about how we are focusing on equity in our COVID response, because equitable response and recovery from COVID-19 has been an absolute top priority for the administration and for ACL. And in ACL, we are working across the federal government to ensure that every policy and every response includes a focus on the unique needs of older adults and people with disabilities. Just to give one example, we've spent the last several months working with so many of you on ensuring vaccine access and equity, because we know if for older adults and people with disabilities, if the strategy is go online, register yourself, get yourself to a site, stand in a long line, try to navigate through an inaccessible site, we won't be getting vaccines to the people who need it the most. ACL's aging and disability networks have literally been on the front line, partnering with public health officials and doing outreach and education, providing supports to people with disabilities and older adults, for registering, for providing services like door-to-door transportation, providing supports to people who need it at a vaccine site, ensuring that vaccine sites are accessible, that websites are accessible, and identifying people who need a vaccine to come to them, for whom it's too hard to go to a vaccine site. We were thrilled that in partnership with the CDC, we recently awarded $100 million to the aging and disability networks across the entire country to enhance their vaccine outreach and to do the work that needs to be done, the direct services on the ground in local communities, to make sure that we can reach every single person with a disability and older adult who wants a vaccine. And that's just one example of some of ACL's ACL's equity focus in COVID-19. The second piece I want to talk about is equity as a focus in the care economy. COVID-19 has absolutely laid bare the risks of institutions and congregate settings and created truly a once-in-a-generation momentum for doing something big and bold to expand access and strengthen home and community-based services. As part of President Biden's focus on economic recovery, he's really been looking at what he calls the care infrastructure and the care economy, which includes looking at both expanding home and community-based services, the very services that Tyree so beautifully explained what they are and the difference they make in people's lives, as well as thinking about how we address both formal and informal caregivers and strengthen the direct care workforce. The American Jobs Plan includes $400 billion, billion. For those of us who have been out there, and I know Tyree and Jean, so many others have been trying to educate Congress and say we need more. This is a return on investment. You know, we've been pushing for millions, but billions of dollars to go into these critical services. It's incredible, looking at both expanding community services and supporting the direct care workforce and family caregivers. In the American Families Plan that the president laid out last week, we know that a really important piece is providing paid family and medical leave. And it was really thrilling to see some of the major issues the aging and disability community has spent really decades talking about being put front and center. But in ACL and the federal government, we are not waiting for Congress to act. There's already been some great things that have happened in the last few months that I want to highlight. Tyree really explained how important money follows the person is. And I have been so privileged to hear Tyree share her story with policymakers to explain what this program is as we were trying to get long-term reauthorization. And because of people like Tyree, at the end of the year, a 3-year reauthorization of Money Follows the Person happened. And we are working very closely with our partners at the Centers for Medicare and Medicaid Services to strengthen and expand Money Follows the Person. And to one of the points that Tyree raised, we know that Money Follows the Person is only about access to services, but one of the biggest barriers, as Tyree said, is the lack of access to integrated, affordable, accessible housing. And that's why we have already partnered up with the U.S. Department of Housing and Urban Development to match up existing housing resources with people who are transitioning. We're doing what we call marriage counseling, connecting up MFP programs and state transition folks on the service side with public housing authorities who have open and existing vouchers to address the very barriers Tyree is talking about. In addition, there was a $12.7 billion increase that was passed as part of the American Rescue Plan in increased funding to states for home and community-based services that started on April 1st for an entire year. And we're working with our partners at CMS, as well as our networks on the ground, on all the ways this funding can be used to strengthen and expand supports. And Tyree, to do some of the really important things that you were talking about with home modifications and making sure that people are not facing barriers. So we're really excited about some of those efforts. And again, with everything we're doing, we are doing it with an intentional lens, trying to make sure that people who face additional barriers because of multiple marginalizations are included and get full benefits of these programs. Family caregiving is another place where ACL has been doing a lot of work. We are charged with implementing the Raise Family Caregiver Act, and our advisory council is in the process of finalizing a report to Congress on recommendations on how we can better support family caregivers. The timing could not be more important as Congress is considering in real time some of these major changes. And we are continuing to strengthen the many programs we have in ACL that provides direct support to caregivers, whether it's our lifespan respite program or our Alzheimer's program or a program supporting grandparents raising grandchildren. We're also focused on the direct care workforce. I'm really thrilled, Sarah, to hear that you've been doing a lot of thinking there. We know this is going to take an all government approach and that this is about equity. When we're talking about such an essential yet underpaid workforce, a workforce that's primarily women, people of color, and immigrants. And we are working with the Department of Labor, with CMS, to think about, even within existing authorities, what we can do to really recognize the value of these jobs and make sure that people have access to good pay and benefits. Finally, I'll just end by saying we can't address equity and expanding home and community-based services if we aren't working across the entire government. And this is a whole of government approach. As I've mentioned, we're working with our partners at the Centers for Medicare and Medicaid Services. We're working with our partners at HUD. As someone who spent decades enforcing civil rights, of course, we have a strong partnership with not only HHS's Office for Civil Rights, but with the U.S. Department of Justice and the work that they are doing to make sure that people's civil rights under the Olmstead decision are vindicated. Let me just close by saying that ACL absolutely shares the commitment of everyone who's participating in this call on advancing equity. And equity means that everyone has a right to receive services that allow them to live the life they want in the community of their choice. We have an unprecedented opportunity at this moment to move forward on these goals. And I encourage all of you to seize on that opportunity. We really look forward to being a partner in that, and thanks so much.
Wonderful. Thank you, Allison. And thank you so much for your very timely comments about how the pandemic has shined a light on certain issues that many of us have been working on for a long time. And now is at the time when there's a much broader recognition of some of these inequities and structural problems that we really need to address. And your hopeful comments about the funding that's currently coming through the federal efforts. We very much appreciate that. And I think probably everyone who signed on to this event is highly interested in how that's going to be distributed and what all the good progress that we can make now that there's a really strong federal initiative, plural initiatives, to improve the quality and make true access much more widely available. So thank you so much, Allison. And I know we'll be back to you in the question section. Next, I am extremely pleased to introduce Jean Axios. Jean heads up AARP's Global Thought Leadership. Wow, that's a big enough job, Jean. And International Affairs. Jean previously served as AARP's vice president, focused on long-term supports and services and livable communities. He brings his deep knowledge about long-term supports and services in the US to his current role, looking at the global view of what innovations, best practices, and structures around the world can help inform improvements in our services and systems here at home. Jean has long been dedicated to a better set of options that are high quality and widely available to people who use services, and we're excited to hear his insights. So Jean, now to you.
Well, thank you so much, Sarah, and to Tyree and to Allison. I am deeply honored to be part of this panel and to really help advance our conversation in terms of building equity as part of not just our response to the COVID-19 pandemic, but also as part of the recovery, and clearly looking at this moment in time as an opportunity in order to do so. COVID-19 has turned our worlds upside down and literally demonstrated the weaknesses of our systems. And while we're all weathering the same storms, what's been clear is that we're not all in the same boat. Not everyone is aging equally, and not everyone has an opportunity to actually have the services and supports that they need in order for them to live a life of dignity, independence, and purpose. In 2017, pre-COVID, the OECD did a report called Preventing Aging Unequally. And this report actually described rising inequities as a global mega trend. In fact, the United Nations noted that these inequities were rising at least 70% across the world's population. So as we saw with COVID-19 spreading across the world, there were two notable developments that was taking place. And you heard that from Allison. One of the big ones was actually the pandemic hitting older adults at a much higher rate. The second was actually looking at the impact that this pandemic was actually having on Black, Latinos, and Native American people, particularly in the US and in some parts of the world, who were hospitalized and dying from the virus at a disproportionate rate. This pandemic has exposed the systematic and underlying challenges facing particularly our long-term care system and the millions of family caregivers who actually support them. However, I think we've got to be clear that, that COVID-19 did not create these challenges. COVID-19 actually exacerbated and amplified what had already been longstanding structural issues with our systems of care, such as underfunding, the lack of accountability, the fragmentation, the poor coordination between health and long-term care systems, an undervalued workforce, as well as an undervalued and unrecognized caregiving infrastructure. According to the World Health Organization, in many countries, more than 40% of the COVID-19 related deaths had been in long-term care facilities, with figures being as high as 80% in some high-income countries. And just last year, the United Nations launched a decade of healthy aging. It's a decade of action aimed at optimizing older people's functional ability and accelerating measurable impact on their lives. And a key finding from this report was that 142 million older people globally can't meet their basic needs, meaning the fact that there's not enough support and services to actually meet their basic needs. The report also made some key recommendations with regards to strengthening long-term service supports, particularly in light of COVID-19. One of the recommendations was around mobilizing funding for long-term care to respond to and recover from the pandemic. Another, and I'll get into this in a few, is around providing support for family caregivers. And you heard a little bit of that, particularly in the US context from Allison. Clearly prioritizing the psychosocial well-being of long-term care recipients and their providers, and then taking steps to integrate the long-term care system and the health system to ensure effective transitions and governance of services, as you also heard from Tyree's experience. So now is an opportunity. This pandemic has really turned a spotlight on home and community-based services as not just a more preferred option. In fact, at AARP, we've done surveys that has demonstrated since the 1980s that the vast majority of people would prefer to receive services and supports in their homes and communities for as long as possible. And in fact, for every one person, particularly in the US, who's in a nursing home, you can care up to about 2 to 3 people in the community. So to Allison's point, it is not just a preferred option, but it's also more cost effective. So the opportunity to align consumer choice with cost savings from a policy standpoint is actually a win-win proposition for all. And we're actually seeing this trend in terms of providing greater home community services globally as well. The devastating impacts of COVID-19 on long-term care facility residents demonstrates the need for greater investments in home and community-based services. Home and community-based services have always been an important and preferred way of supporting people as they age, because they allow them to remain in their environments and their communities surrounded by their loved ones, and allow them to engage in the full range of activities that the community actually has to offer. Receiving this care also harnesses the strength and resilience of older people. In 2020, we at AARP co-sponsored a dialogue series with the World Economic Forum and the US National Academy of Medicine. And the summary outlined here are several recommendations with regards to a focus on home and community-based services that I think that is critically important for our conversation today, particularly as we think about greater equity and building systems that can meet the needs of people, particularly as they age in their homes and communities across the globe. One of the key recommendations was the fact that home and community-based services will look differently around the world, and that there's a lot of opportunities to learn from what other countries are doing. And I will share some examples with you today. Another is the fact that we really need to pay greater attention and to be paid to designing national health systems with a strong integrated home and community-based services component. Going back to my earlier point with regards to the decade report, resources must be devoted to building and enhancing the home and community-based models of care, was another recommendation from the World Economic Forum and the Academy of Medicine. And of course, thinking about the multidisciplinary approaches to determining individual care needs and services with the financing mechanisms that are needed in order to ensure that they are scalable, comprehensive, and provide high quality care. And finally, it's important to note that home and community-based services must mitigate social isolation and loneliness and prevent any and all over-medicalizing care that is actually provided. We know that we must also look at the continuum of care in this process, and that as we are thinking about and reimagining the opportunities for creating greater supports, particularly in the home and community-based services area, that we also have an opportunity to really improve care in facilities, whether that's through providing better compensation, training, and consistent work, or improving career pathways, promotional opportunities and benefits for workers, as in the case in Australia and Canada, or advancing the role of technology, which has been critically important. And we saw the implications of that, particularly during the lockdowns, as part of the care delivery, is important elements for us to be thinking about as we redesign and rebuild our systems. And then finally, integrating the long-term care and health systems with long-term care providers recognized and their family caregivers are recognized as integral parts of the care team is going to be critically important. So how are some of the countries around the world responding to the pandemic in a way that is advancing home and community-based services? We've seen several countries increase funding and support for long-term service supports in response to COVID-19. Australia, for example, issued plans to increase staffing. Spain set up rapid response teams to intervene in certain institutions. Germany issued financial support for long-term care workers. We've seen community care models such as Ibiso, which means a place where you can feel like yourself. In Japan, enable older adults to participate in organizing and providing care, and to help shift the narrative away from victimhood of older people towards recognizing them as valuable resources for their communities. And in some parts of the Caribbean, people are working to develop practical training to educate and support family caregivers to deliver care to their loved ones. We know that the Dutch, Norway, and Sweden prioritize home and community-based services. These countries significantly outspend the US as a share of GDP. Many of the leaders, including David Grabowski and others, have been strongly advocating that countries should increase public spending on long-term services supports, with the bulk of that going to home and community-based services. We've seen also great responses with regards to opportunities to not just support family caregivers, but also to provide additional support to direct care workers. Quebec offered bonus pay for long-term care workers in public and private institutions, and also those who are actually helping to support their people in the community. And then also the government of Mexico partnered with the Mexican Association of Insurance to actually provide and offer free life insurance to 1.6 million healthcare workers, thinking about, again, the opportunities to integrate health and long-term services and supports. So as we think about the opportunities moving forward, we can also look at what is going on in Spain. The central government of Spain issued several supports for unpaid family caregivers, including adjusting working conditions and with proportional salary adjustments and a moratorium on mortgage debt. So we're at an inflection point. On one hand, we can preserve the status quo with a patchwork of solutions whereby any inequities continue to fester and harm the most vulnerable among us. Or we can reimagine our current systems and rebuild in ways that really expand opportunities to achieve longer, healthier, and more productive lives for all, so they can actually thrive as they age. And with that, I thank you, and I'm going to turn it back over to you, Sarah.
All right, thank you so much. I feel like we should change your job title to ambassador. And I really appreciate you bringing this wider view and helping us think about really ways that we can do all of this service provision better, so that we really serve people, because people just want to live their lives, and other countries can probably help us a lot with your examples and others that you'll continue to bring to us to inform our next steps, so that we can really create a accessible, universal set of services for those who need them. So I'm going to move to the question segment now without delay. And the first question that we have is for Tyree. And the question is, thanks for discussing this important topic. Can you kindly clarify a statement that you made related to the 6-month rule? Do you have to be home for 6 months prior to accessing the home and community-based services? Thanks very much. So anything you can add about your experience bumping into that particular rule?
Yeah, so once you, how can I explain? While I was in the nursing home, I was in the program for community. I was in the waiver program. So how can I explain? In order to get the home modifications, specifically how they reconstruct your home, you have to be home for a certain amount of time. You can still receive services from the program, just not that particular service. If that answers the question.
Yeah, so it sounds like we need to maybe review some of those probably state level rules that have been put in place to, can understand the motivation to make sure that people who really need the program are enrolled in it, but probably need to review some of the structures and rules so that we don't have people stuck in a nursing home, because you obviously can't be in two places at once, and you can't use your home until you have the ramp and the stair glide. So thank you for amplifying that, Tyree. Here's another question, and I believe this is for Allison. At 63, my sister had a stroke leading to left side paralysis. Personal services through her Texas area agency on aging are limited to about 12 hours a week for only 3 months out of the year. Additionally, the AAA says that it will not provide any services to her if she or her family are paying for additional services. So it's either all or nothing, you're in or you're out. Like Tyree, my sister is paralyzed every month of the year. How can a AAA have such a discriminatory service package, penalizing people who have more needs or have more resources to purchase some services in the market? And I'm going to infer that this relates to a person who does not qualify for Medicaid funded services, but is trying to use AAA Older Americans Act funded services in Texas. So any comments?
Yeah, let me start, and it sounds like I need to do some homework on what's happening maybe in Texas. Unlike, as Sarah mentioned, when someone qualifies for Medicaid and there's a set package of services that people can get, we face barriers in the Older Americans Act because we only get a set amount of funding. We push those down to states push those to specific area AAAs, and they really have to focus on prioritizing how do we meet the needs of the most people, how do we target that. So, I think what I can say is we do not have enough funding to meet the needs. And that's very clear. We really rely on stakeholders like you, AAAs, others, to educate members of Congress about how important these home and community-based services and supports are that are outside of the home and community-based services funded by Medicaid. Because in order for someone to qualify for Medicaid services, as Sarah mentioned at the beginning, they basically have to spend down all of their income, all of their assets. It is a poverty program, and it's really, I think, one of the biggest barriers. We keep working on how to make Medicaid HCBS better, but at its core, the big problem is you have to meet these financial requirements. So I will look into some of the specifics in Texas, and if you want to put in the mailbox your address, I can follow up. But I think at its core, the problem is with the Older Americans Act services, we're really limited by funding, and the AAAs really have to decide how to prioritize in how much services and how many people to reach with the limited funding.
If I could just add on to Allison's points, one of the reports that we did several years ago, and this was with our AARP Michigan State office, and several of our states are actually working on disparities, strategies and initiatives to really close these disparities gaps, particularly in the context of health, and then also in the context of wealth. And interestingly enough, what we learned, particularly through the work that was going on in Michigan, was how the waiver slots are allocated by county. And in this particular situation, half of Michigan's population lives in 10 counties in the southeast part of the state. And one of those counties is Wayne County. And Wayne County has 40% of older adults who are people of color. However, only 1/3 of the state's total HCBS waiver slots are available in those 10 counties. So in other words, there is only one waiver slot for every 58 eligible individuals in those counties, compared to one slot for every 20 eligible individuals in the rest of the state. So I do think that as we are having these conversations, is to really kind of think about the systems in the context of the US, where you live matters significantly. And you can actually have a different experience in another locality or another state. But I think for all of us who's watching this webinar today is to really kind of dive deep into some of the systems and what are some of the intended and unintended consequences of certain policy decisions, and do we need to revisit those? Because if we're not revisiting those, are we perpetuating some of the inequities that we're trying to solve?
Excellent, excellent points. Thank you for raising that. The next questions, there are a couple questions about timing, and I'm going to tack on my own question, but this is initially for Allison, and then others come in as you wish. So do you have any indication of when the funding will start to be distributed through CMS or several different funding streams, and what the timeline might be like for these additional resources? And then also, you mentioned, the 400 billion with a B, which we're all very excited about, but is there additional money also flowing through the ACL Older Americans Act funding stream to start to take care of some of those deficits in funding?
So let me start with the Older Americans Act. Yesterday, so fortunately, in many of the supplements that have been passed by Congress, including the last one, the American Rescue Plan, there was specific Older Americans Act funding. And this latest supplement included 1.4 billion with a B, in funding that goes to states that covers a whole wide range of services, from nutrition services to the home and community-based supportive services that we talked about, to the Title VI tribal services, to caregiving services. And I can, or if someone can find it, we have on our website, we just put out yesterday exactly the breakdown, but that actually hit states yesterday and should be being pushed out. And that can also be used, some of that funding, for vaccine access. That's in addition to the CDC funding. So there is some additional funding that is out there. Of course, the need is not going to end with this one supplement. And so continuing to educate Congress about the ongoing need, it's kind of leveled off at about 60% increase in demand for services. And as the Congress is starting to work on the next year appropriations for fiscal year 22, it's going to be important for folks to continue to educate about those ongoing needs. As I mentioned in the American Rescue Plan, in the Medicaid funded home and community-based service system, there is a 10% increase in the federal match. That started on April 1st, and states can begin drawing that down. It goes April 1st through May 31st. Imminently, hopefully very soon, will be guidance from the Centers for Medicare and Medicaid Services that will be more detailed on exactly what you can use it, the logistics of how to bill for it and draw down that money. We have all been working very, very, very hard to get that out, and hopefully it will be out very, very, very soon. I think then, just to answer your last question on the $400 billion, just to be clear, that's a proposal from the White House. And, Congress is now working on drafting what will be legislation to implement the American Jobs Plan. That was, again, just the president's priorities. What gets put in legislation, what actually can pass both the House and the Senate is yet to be seen. So it kind of goes to my point on opportunities. This is a really important time for stakeholders to really be educating members of Congress about the huge need and how important this is. As Senator Casey has repeatedly said, that there's no doubt that the human beings we're talking about in caregiving, this is infrastructure. This is the core of our country, but there is still work to do. So I'm not sure what the timing will be on that. That's all in Congress's hand. We are hopeful it is a sooner rather than later endeavor, but there is definite funding that exists now.
Excellent. Thank you so much. Yeah, thanks for reminding us of which is where, and where things are in process. And there are some links in the chat to some ACL, some items on the ACL site about budget and also about announcements, funding. So I encourage people to look at those. We've had a couple of requests, Jean, for the report that you mentioned, and we can make that link available later, if not now, because we're the last final minute of our session. And we still have questions about other big topics in the chat and the quick Q&A that we won't get to today, but we'll continue thinking about mental health and substance use service availability, both for the people who provide care and the people who use services, and about making PACE more widely available as another very viable home and community-based service option. I apologize that we did not get to those questions today, but as you can see, we have much to talk about. And I just want to wrap up our session here by giving absolutely effusive thanks to our three panelists, to Tyree Brown, Jean Axius, Allison Barkoff. We appreciate you so much sharing your wisdom, your time, and your information with us. And this has been a fabulous panel. We're very grateful to everyone who came and participated and listened. And with that, we will wrap up our webinar. Thank you so much.